Hello everyone, welcome back to our channel. Today we're going to talk about a very important health topic, leukemia. What causes it? Who is at risk? And what are the early signs you should never ignore? We'll break it all down clearly and simply, so let's get started. First, what exactly is leukemia? It's a type of blood cancer that starts in the bone marrow. The bone marrow is like a factory inside our bones that produces all our blood cells. But in a healthy person, this factory works perfectly, making red blood cells to carry oxygen, white blood cells to fight infections, and platelets to help us stop bleeding. But with leukemia, something goes wrong. The bone marrow starts producing abnormal white blood cells that don't function correctly. These abnormal cells multiply uncontrollably and start to crowd out the healthy blood cells. This crowding is what leads to the many symptoms of leukemia because the body no longer has enough normal cells to do their jobs. Imagine a production line suddenly making 40 products that clog up the entire factory. That's essentially what happens inside the bones. So the big question is, what causes this to happen? The exact cause of leukemia isn't fully known, but scientists and doctors have identified several key risk factors that can increase a person's chances of developing it. One of the primary culprits is genetic mutations. Our DNA is the instruction manual for our cells. If there's damage or a typo in the DNA of a blood-forming cell, it can cause that cell to grow and divide uncontrollably. Sometimes these mutations happen randomly for no clear reason. In other cases, they can be inherited from our parents, passed down through the family line. Another major risk factor is exposure to high levels of radiation. This isn't the everyday radiation from our phones or microwaves. We're talking about very strong, ionizing radiation, the kind used in certain medical treatments. For example, people who undergo radiation therapy for other types of cancer have a higher risk of developing leukemia later in life. Similarly, survivors of nuclear accidents have shown a significantly increased incidence of leukemia due to the intense radiation exposure they experienced. Exposure to certain chemicals is also a well-documented risk. One of the most studied is benzene. Benzene is a chemical found in crude oil and is used to make plastics, resins, and some synthetic fibers. Long-term exposure, especially in industrial workplaces where it's used heavily, has been directly linked to an increased risk of developing certain types of leukemia. This is why workplace safety regulations are so critical for people who handle these substances. Ironically, some of the very treatments used to fight cancer can themselves become a risk factor for leukemia later on. People who have been treated with chemotherapy or radiotherapy for another cancer have a higher risk of what is called secondary leukemia. The powerful drugs and radiation used to kill cancer cells can sometimes damage the DNA of healthy bone marrow cells, leading to a new cancer down the road. This is a known risk that doctors carefully weigh when planning cancer treatment. A lifestyle factor that significantly increases the risk is smoking. We often associate smoking with lung cancer, but its dangers are far more widespread. The smoke from cigarettes contains numerous harmful chemicals, including benzene, that are absorbed into the bloodstream. These toxins travel throughout the body and can damage the DNA in bone marrow cells, disrupting the normal production of blood cells and raising the risk of acute myeloid leukemia, one of the most common types in adults. Family history can also play a role. If you have a close relative, like a parent, sibling, or child who has had leukemia, your own risk is slightly higher than the general population's. However, it's important to remember that most cases of leukemia are not inherited. Having a family link is a small piece of the puzzle, not a guarantee that you will also develop the disease. Finally, certain pre-existing medical conditions can increase the risk. People born with specific immune system disorders or genetic syndromes, like Down syndrome, have a higher statistical chance of developing leukemia. A weakened or malfunctioning immune system might be less effective at finding and destroying abnormal cells before they can turn into cancer. These conditions create an environment where the cellular mistakes that lead to leukemia are more likely to occur and persist. Now, let's talk about the signs and symptoms. Leukemia often starts quietly, and its early symptoms can be vague and easily mistaken for other common illnesses, like the flu. That's why it's so important to pay attention to your body and know what to look for. One of the most common symptoms is constant tiredness or weakness that doesn't get better with rest. This happens because the abnormal cells are crowding out healthy red blood cells, which carry oxygen. Without enough oxygen, you feel perpetually drained and fatigued. Another frequent sign is getting sick all the time. If you find yourself catching one infection after another, it could be a warning sign. Leukemia affects your white blood cells, which are your body's main defense against germs. When they aren't working properly, your immune system is compromised, leaving you vulnerable to frequent or severe infections. Easy bruising or bleeding is also a classic symptom. You might notice bruises appearing from minor bumps, or even for no reason at all. You could also experience nosebleeds, bleeding gums, or cuts that take a very long time to stop bleeding. This is due to a shortage of platelets, the blood cells responsible for clotting. Unexplained weight loss is another red flag. If you're losing weight without trying, without changing your diet or exercise habits, it's something to take seriously. Cancer cells consume a lot of energy, which can lead to this unintentional weight loss. Night sweats are also commonly reported. We're not talking about just feeling a bit warm at night. These are drenching sweats that can soak your pajamas and sheets, often related to the body's response to the leukemia cells. Other potential signs include swollen lymph nodes, which might feel like painless lumps in your neck, armpits, or groin. You might also experience bone or joint pain. This pain is caused by the buildup of abnormal cells in the bone marrow, creating pressure from within the bones. And finally, pale skin, which is another result of the low red blood cell count, or anemia, that often accompanies leukemia. If you notice several of these symptoms and they don't go away, it is crucial to see a doctor. This leads us to a very practical question. Can leukemia be prevented? Unfortunately, there's no guaranteed way to prevent leukemia, especially the types that are linked to random genetic mutations. However, you can absolutely take steps to lower your risk by managing the factors that are within your control. The most impactful step is to avoid smoking. If you don't smoke, don't start. If you do smoke, quitting is one of the best things you can do for your overall health, including reducing your leukemia risk. Next, try to reduce your exposure to harmful chemicals. If you work in an industry that uses chemicals like benzene or formaldehyde, make sure you follow all safety protocols, use protective gear, and ensure proper ventilation. Maintaining a healthy weight and eating a balanced diet are also important. Obesity is linked to a higher risk of several cancers, including leukemia. A diet rich in antioxidants, found in fruits and vegetables, can help protect your cells from damage. Think colorful plates with plenty of greens, berries, and other whole foods. Protecting yourself from unnecessary radiation is another smart move. While medical X-rays and scans are often necessary and use low doses, it's always wise to avoid radiation exposure when it's not medically justified. Finally, strengthening your immune system through healthy habits can help. Regular exercise, getting enough sleep, and managing stress are all key components of a strong immune system, which is your body's first line of defense against all types of illness, including cancer. Leukemia is a serious illness, but it's important to know that advancements in treatment have dramatically improved survival rates. Early detection makes a huge difference in the outcome. If you notice any of the symptoms we've discussed and they persist, please don't ignore them or try to diagnose yourself online. Make an appointment to see a doctor and get checked out. It might be nothing, but it's always better to be sure. Thank you for watching. If this video helped you understand leukemia better, please give it a like, share it with someone who might find it useful, and subscribe for more health education content. Your support helps us create more videos like this one. Stay healthy, and we'll see you in the next video.